At about 6 months of age, Evan was diagnosed with a genetic illness called Leigh syndrome. It affects the mitochondria in each cell of the body, and so that causes low muscle tone, and the prognosis was much shorter lifespan than we would have expected. So we began a very interesting journey because there was no treatment or cure for the disease. We came back home and began a lot of rounds of physical therapy and different supplements and medicines that controlled seizures and created the best possible life for him that was available given his diagnosis. And that seemed to work, and he seemed to actually thrive under that for, I think, about 1.5 years until November of 2015, would have been, that he was suffering a respiratory infection and ended up in the hospital in the emergency room, and that led to a hospital stay of about 14 weeks. So upon discharge, there was the medical field recommended that we come home with both 24/7 nursing coverage and hospice care. To give even a little additional perspective, for that 1.5 years before he was in the hospital, my wife was spending about 6 hours a day just feeding him, as well as administering several rounds of medication and going to physical therapy for 2 or 3 times a week. So it was a very full-time caregiver life that we were working through and living.
Prior to having the idea sort of provided that we could have hospice care in our home, I think we traditionally thought of hospice as end-of-life care for elderly, older folks. And when we got to the end of his hospital stay in February then, they talked about this concurrent care with having pretty aggressive home nursing care, still providing treatments and medications and treating infections and those things, but then also having the hospice end of it for extra support and providing the additional things that we needed.
For families with your young adolescent or even a young adult that may be unfamiliar with the idea of hospice, especially at the time of life that we're experiencing, it is a hard idea to wrap your mind around, and that should not be the case. I think that we should look at hospice as a way to live life more fully.
Well, we come in, the nurses at least, Tina and I kind of co-manage Evan's case because it's pretty complex, and with his family and his young age, we want to make sure that we keep the consistency of care between 2 nurses so we don't have to have different faces coming in all the time, and we can keep a running track of everything that's going on and the changes and things.
We do a lot of emotional support in conjunction with the social workers. We're on call 24/7, so these families have support all times of the day or night. If anything is going on or changing, we can be there for them. We even go out in the middle of the night if things have changed suddenly, and maybe there's some questions about what to do next.
I'm a part of the hospice team in the social worker role. So our role is different with every patient and family, but we work a lot with emotional support to patients, their families, work a lot with coping and assisting people with that process. We know the decision to seek hospice is not an easy one, and so we try to help with that process and also just help with various resources, so that can be very different for each person. We visit every patient at least once a month and kind of check in with them, see how things are going, see if they need anything from our hospice team that they're not getting, and providing that support to them. We always check in with family too if they're not present at the visit with us, to see how they're coping and how they're doing.
It's actually much less awkward than originally we thought it would be to have people in your home all the time and people coming and going. Thursdays we usually call Day of the Revolving Door because it's people in and out, hospice visits, case manager visits, physical therapy visits, things like that. But yeah, it's actually after a while it's comforting to have people here, and they really do become like part of your family. I can shoot Danny a text message or Tina and be like, can you guys bring Chucks the next time you come, or things like that. So you really do establish close relationships with the people.
As a hospice nurse, I deal with dying every day. It can catch up with you. It's particularly challenging with the pediatrics. Makes you step back and think about life. That's important. I think it makes me a better mother. I learned so much from the families. Sorry. I have learned so much from the families as we walk through this journey with their children. They've shown me such strength and resiliency. They still find humor in situations, and I think I've really grown through that. I'm very thankful to be a part of it, especially with hospice. Because of our benefactors, there's so many things that we can offer them that they would have missed out on had we not been there. So I do feel that we are a benefit to them. And just being able to be home as a pediatric patient and in your own environment with your own family, rather than having to spend the rest of your days in a hospital, I think that's an awesome opportunity that we offer them.
He's able to come home and sleep on our laps. Or he's able to come home and be in an environment and around people and enjoy family and friends that can stop by, and folks that we know. So I think it's been a wonderful experience.
Essentially, how I see hospice is an extra support for our daily lives, and I've always said they kind of are able to really fill in the gaps that a home nurse cannot do, and they've provided things like the hospital bed for Evan. That was huge for us coming home from the hospital when he was hospitalized for really all winter last year, to come home and have the hospital bed and the supplies we needed and medications covered and refilled and taken care of. And they also, when we came home from the hospital with Evan after his sickness last year, at first especially, we did not have all of our home nursing care shifts filled. And so there were a lot of shifts that we were still covering, and overnight shifts that we as a family were taking care of because we didn't have a nurse in here. So they were an excellent resource, and they were there for us to contact and would say, well, we can just stop by and take a look and check them out if you want somebody to come by. So that was really helpful too. So I think those are two really main things that they've been able to provide for us to keep Evan at home. I think hospice care originally sounds like sort of a scary, anxiety-ridden experience, but really it's been such a blessing to our family just to have hospice care involved.
Hospice has made such a great impact in our lives. I hope that our story has shared with you the benefit of that service, and we thank you for your generous support of hospice and hope that you can continue to support hospice in the future.
On behalf of our family, we want to thank you for attending tonight, for attending this event, and for your support of hospice. And I can assure you from our personal experience that hospice has really improved the quality of life that our family is able to experience.
Thank you for giving to hospice.